So I'm a psychobiologist, and my interest is how the body moves and how people respond to different kinds of stimuli. And today, what we're looking at is if we can actually measure clumsiness in the home and whether we can determine a little bit about the basis of that clumsiness. And what we've done is we've created an entire laboratory here with a variety of different ways of looking at clumsiness. So this test is the Stroop test, and it is very good at measuring how distraction affects people. So what we are looking at are a series of words in different colored inks. Sometimes the words match and sometimes they don't. So you might have the word red in the color blue. In that case, your job is to just press the blue button there. What this allows us to do is look at how these two different stimuli interfere with one another so that we can tell a little bit about whether people are easily distracted. In order to determine whether or not people are coordinated or if there is some lack of coordination, maybe that's causing someone's clumsiness, one of the things we can do is a drop and catch with a ball. That is, over a 60-second period, take a ball, lift it, drop it, and catch it. Seems pretty simple, and it is. But over 20, sometimes people will drop them, and if they're clumsier, they may have the ball bouncing off their body. And we score how well people coordinate this dropping and catching motion. So this is the breakfast task, which is the overall task to determine clumsiness. We've got 12 minutes to make a breakfast for 4 people, and it's quite complicated, so a lot can go wrong. While they're making the breakfast, to determine whether we can detect clumsiness, we're both looking for spills, which is an obvious issue of clumsiness, but we're also using motion capture. So we're looking at these small balls, which will be worn on a headband as well as on their shoulders, and this will allow us to triangulate exactly where in the room they are, so we can see if they're making clumsy movements, if they're making too many movements, or too few.